Hello, you have just returned home from undergoing surgery for trigger finger. I would like you to take a few minutes to watch these postoperative instructions to ensure you have a smooth and quick recovery. Post-surgery pain is often described as mild. As pain tolerance varies highly from one person to another, you can manage your own discomfort using the following pain medications: Tylenol, ibuprofen, and narcotics such as oxycodone. You may combine them as long as you respect their maximum dosages. Check with your pharmacist for interactions and contraindications. The goal is to prevent the pain before it starts. Keeping it under control is essential to be able to participate actively in your recovery. You should stop taking your prescribed narcotic pain medication as quickly as possible to avoid side effects such as constipation or nausea. You should never drive while taking narcotic pain medication. These exercises can help you relieve discomfort after surgery. Raise your hand or both hands if you had bilateral surgery above heart level to help promote venous drainage and reduce swelling. Elevate your arm completely over your head to help minimize swelling faster. Repeat a few times every day for the first 4 or 5 days. You may apply ice on the surgical area. Use a cloth or a Ziploc bag and apply for 15 minutes at a time to avoid burning your skin. The surgical dressing covering the area of the incision can be removed the day after the surgery. Keep the stair strips in place until your next visit. You may notice some dried blood under the surgical tape, which is perfectly normal. You can protect the area with a Band-Aid if necessary. You may shower and wash your hair the first day after surgery. Pools and jacuzzis should be avoided completely. Bathing is permitted as long as you keep your hand out of the tub for the first 2 weeks. You should skip dish duty and take a break from gardening. Be careful around animals and pets. Make sure to protect your hand to avoid and prevent infections. The 2 small incisions should heal within 2 to 3 days. You must start exercising your wrist, hand, and fingers immediately after surgery. Your tendons have been released and we want to prevent adhesions. As soon as you get home, you should move your fingers, hand, and wrist to their maximum range of motion. Close and open your hand completely and attempt to fully extend your fingers using the other hand if you need to. Repeat 10 to 12 times, 3 times a day until your next appointment. These exercises might cause some discomfort. Do not hesitate to take your pain medication 20 minutes before in order to make sure you do them properly. Icing the area after the exercises will also help with the pain. Do not use stress balls for the first 2 weeks, as they are designed to help regain strength rather than range of motion. Using them early in your recovery could cause inflammation. Driving is permitted as soon as you stop taking your narcotics. Most patients can resume driving 1 or 2 days after surgery. When you may return to work depends on your occupation and how fast you recover. Do not forget your follow-up appointment, which will normally take place in about 10 days. This visit is important to evaluate your progress and discuss your return to work and other activities. Until then, you should contact us if you develop fever, pain, or notice unusual drainage or redness around the wound. I encourage you to contact us if you have questions or concerns. I look forward to seeing you again very soon.